All right. Um, Here we go. Hello, everybody. This is Suzanne, Kelley. Pam, if you can still hear me, can you just let me know if we're recording?
Yes, we are recording, and I think we're fully set now.
Okay, here we
People
go.
are still joining. Yeah, people are still joining. We're doing okay.
All right. Should I wait another minute, you think?
No, I think we should go ahead.
Okay. Hello, everybody. This is Suzanne, Kelley. Welcome to today's National Physical Activity Society webinar called the National Physical Activity Society Survey, Public Health Physical Activity Practitioners in 2018. I am Suzanne Kelley, and I'm the president of the National Physical Activity Society this year, and I am also the manager of Vermont's Healthy Community Design and SNAP Ed programs. Let's see, today starts the fall series of 3 webinars. First, we will have this presentation and discussion on the survey we conducted in the spring. Hopefully many of you saw that and contributed to it. Next month, on October 15th, we will hear from Ian Thomas with America Walks, and Ian will be sharing some results from a comprehensive outcome survey that was conducted with 47 fellows who completed the Walking College in 2015 and 2016 that Walk America hosts. So join us on October 15th to hear about the impact Walking College Fellows have in their communities and to get some other updates from America Walks. And then on November 19th, we will have a presentation on mental health and physical activity from Dr. Kara English. If you aren't signed up for our mailing list, please be sure to do so with the link that you receive after the webinar today. This webinar is being recorded and can be found later today at the National Physical Activity Society website, which is physicalactivitysociety, all one word, .org. Throughout the presentation today, you can submit questions to today's presenter by typing in the questions pane of the control panel. Send questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of the presentation. The continuing education certificate is posted here on the webinar and will be available on our website later this afternoon. Physical activity and public health specialists will earn 1 credit for today's webinar. So for today, every 2 years, the National Physical Activity Society conducts a survey to assess members' needs. Presenting the results of the 2018 survey today is Pam Eidson, our executive director. Pam has experience at 2 state health departments, West Virginia and Georgia. She began working on physical activity issues about the time she stopped working on tobacco control circa 1999. She spent 11 years with the Directors of Health Promotion and Education, finishing there as Deputy Director. Pam was part of the original formation of the National Physical Activity Society and has been back with us as Executive Director for 5 years. So Pam, I am going to turn it over to you.
All right. Thank you, Suzanne. And it's nice to be with everybody as a presenter today and not just as your staff member and host. I was supposed to present a version of this presentation this weekend at the Physical Activity and Public Health course sponsored by the University of South Carolina, but there was this hurricane, and so we didn't actually have that meeting. The PAPH course had to be postponed because of the hurricane, and so at least the practitioners element of it did. So it looks like we're trying to scramble to find a way to make up for that, because I know some of the folks on the call have attended that course in the past when it was held in South Carolina or in Utah, and it's been a really valuable part of their training and education as PAPH specialists. So later today, we will have this presentation up on physicalactivitysociety.org, as Suzanne said, and there will be some handouts eventually that will also be with it, but I wanted to unveil it first as a webinar before we put it up there as handouts. So we conduct this survey every other year. It's actually been conducted since 2007, and this is our 6th iteration of it. You might notice that 2007 is not an even numbered year. I think there was one period in there where it was 3 years before we did another one. So this is our 6th one. I was involved in the first 2 and the last 3. So there was only one that I wasn't involved in. The purpose is dual. We want to assess training needs for people who are in physical activity and public health. And over on the right-hand side, we want to find out more about our members and people who do this work. So just thinking about the training needs primarily for us, that's around designing webinars and any kind of other trainings that we're involved in. We also want to share information with partners on their own priorities, and that comes up here, particularly in thinking about such things as the physical activity plan. We also want to be able to describe where our members work when we find out about our members and PAPH people, and to be able to talk with some authority about NPAS when we go to conferences or meetings or develop poster sessions or put changes on the website, etc. So the protocol has been that it's every other year. We use SurveyMonkey. Its distribution is to our entire email list. We do 2 reminders. The partners that are listed there are ones who helped us to advertise, National Coalition for Promoting Physical Activity, the National Physical Activity Plan Alliance, the Everybody Walk Collaborative, the Active Schools Group, and the Association of State Public Health Nutritionists. On social media, we limited it to Twitter and Facebook this time. We put updates on the website, and every time we do this, we open for about 3 or 4 weeks for responses. This time around, it was May 1st through 25th. So let's talk a little bit about who answered the survey and where they are. Our end this time was 256. 2 years ago, it was 187, and actually 4 years ago, it was right around that at 186, 187. So we had more responses this year. People came from 45 states, plus the District of Columbia, and several other countries who responded to our survey. This word cloud shows you that the bulk of them, or at least the plurality, the most were in California and New York. Now, being in those places doesn't necessarily mean that they were representing those states. It just means that the person who answered was located within that state. But that's a similar number to what we had 2 years ago. And occasionally during this presentation, I will show some slides from 2 years ago so you can see the comparison. And this is probably where I should mention that I'm not a researcher. I'm a public health practitioner. I did ace my research methods class in grad school, but I do not claim that I've done any kind of statistical derivations or confidence intervals or anything like that. This is a needs assessment, not a randomized control trial. So the first thing we asked is, where do you work? Do you work at state level, community level, national? As you can see, and this might be surprising to some of you who know about the origins of our organization, more than half the people work at the community level. A good third work at the state level. And that was similar to what we got last time with a little bit of changes. And then we also asked, who is your employer? And up there at the top, that should say 27%. I think the percent got cut off. The top 3 are state public health agency, university and other higher ed, or local public health agency. Now, those of you who are wondering might see that just a moment ago we said that more than half work at the community level, and now we're saying that local public health agency only has 15%. Well, there's a couple of explanations for that. One is that some of the next few things down there are also about local level, whether they are nonprofit or hospitals or other government than public health. And the other is that in some states, if you are a local level public health person, you're also a state employee. So people might have answered these 2 questions differently. I know in Georgia, for instance, at the district public health level, those folks are state employees. And so if you ask about employer, you might get a different answer than if you ask where you work. Our education level of people who respond to our survey is really high. More than half have a master's degree or higher. Actually, it's up to 3/4 for that. And there was nobody who answered who had less than a bachelor's degree. That was out of the 173 people who responded to this question. That was very similar numbers to what we had 2 years ago. And I remember the 79% figure of master's degree or higher was the same in 2014. Folks have been working in physical activity for a while. 10 plus years got by far the biggest response. If you add those 2 together of 5 plus years, you see that that's about 65% of the respondents have been working in physical activity for longer than 5 years. And that compares favorably to 2 years ago when it was 58% who've been working in PA for at least 5 years. So we have people who are highly educated and highly experienced. However, and this surprises some folks, physical activity is not necessarily the full-time job. So only 16% of people said that they are full-time on physical activity. Another 1/5 said they are half-time at least. And then most, that's 3 out of 5 folks, said that it's one of several areas that they work on, whether they are supervising lots of areas or whether they're working on both physical activity and nutrition or tobacco or teen pregnancy. And those numbers were similar 2 years ago as well. Now, support at work, and we asked this primarily because it is so hard to do some of this work at alone, but about 1 in 5 works alone in physical activity, and then about 30% have at least 4 people at their location who do physical activity. And really the reason here is that it is, there's a different atmosphere when you have a collegial thing and people are able to talk with each other about ideas and really develop them together. 80% of our respondents are women. This was exactly the same as 2 years ago. And I was so shocked by this number that I went and checked against our mailing list for those names that I could recognize as being either women's names or men's names, and it came out 80-20. I've worked in public health for almost 30 years, and this has been the most male-dominated of the fields that I've been in. And so I was a little surprised to find that it was 80% women who responded to our survey. I think that maybe we need to get more women on the speaking circuit for physical activity. We are not a very diverse population. Race tends to be white. This is similar 2 years ago. In fact, it was higher numbers. 9 out of 10 were white on 2 years ago. And I think that just shows that we're not representing the populations as well as we need to be. So there's some diversity needs there. Background overwhelmingly was in public health or community health, and that says exercise science or kinesiology. But people do come from a variety of backgrounds, including a good 6% on urban planning. And so we've had some appeal over the last few years to people who are working on planning issues at the community level. All right, so what do members do? Every time I tried to do a chart on this, it didn't work out very well. So I'll just pull out a few things that people responded to. For example, there were a lot of ideas to check off, and consulting with partners on physical activity efforts was the one that was checked off the most. People are building capacity on their PA for their state or for their local area. They're recommending effective intervention strategies. They might be working on something that's within a technical bolus, such as walkable community initiatives or active transportation. And most folks are working on high disparities communities. Well, actually, that's not most, but 40% are working on high disparities. And here's some more of those things. I mentioned just coalition and collaboration, also in safe routes to school. I think that the teaching over there on the right-hand side just reflects that we have fewer people responding who are full-time teachers. But we do have at least 10% who are doing each of K through 12 and public health higher ed. So then we looked at some national resources. And the first one to talk about here is the U.S. National Physical Activity Plan. I was involved in the plan back in 2010 when it was first launched, and I'm on the board for the National Physical Activity Plan Alliance. The revised plan was issued in 2016. And it looks like about half of our members have used the National Physical Activity Plan in their work. Just if you're not familiar with it, the National Physical Activity Plan, the website's right there on our screen, and it involves different sectors of community and how those can help to promote physical activity. It's worth taking a look. I'm most familiar with the public health section of it, but it has things on community recreation, fitness, and parks, on education, on transportation, land use, and community design, etc. And that's at physicalactivityplan.org. The number was fairly similar to 2 years ago when it was 42% who had looked at it. And again, this time around, we showed that it was up to close to half. Suzanne, I'm going to pause for a moment because I see that there's a question coming in and I can't actually read it from where I am.
No, what I'm trying to do is send something to let folks know they can include questions. So,
all right, thank you.
Yep, so you're good. Keep going.
Okay. So then we asked, how was the national plan used when you used it in your work? And, people had a variety of responses, but the top ones that got the most check marks there were about explaining multi-sectoral approaches to public health and physical activity, setting framework for state and local planning of interventions or policies, persuading stakeholders to participate in physical activity efforts, and technical assistance and policy efforts. We also asked about the 2008 physical activity guidelines. And I think this is kind of unsurprising, but almost 80% of people said yes, that they had used those in their work. Similar, it was also in the 70s there, 74% 2 years ago when we asked it. So it's not terribly surprising. How were the PA guidelines used? They were used to help set written goals and issue messages for individuals and populations. And those included both the adult messages and also the children's recommendations. They also were used in informing policy initiatives, et cetera. The PA guidelines have been being revised for the last 2 years. They had an scientific advisory committee that met 5 times, and those sessions were broadcast and actually I think are archived at health.gov. And the new PA guidelines should be out, the 2018, before the end of the year. So we're going to be looking for that and be able to publicize it when it comes out. So let's get into what the needs are that people have identified. And the first question is not actually something that we asked as a need, but we asked, where does your funding come from? This survey was taken in the spring. And you can see that the vast majority, the largest bar is of federal funding at almost half. And the vast majority of those answers, when asked to write in what federal agency they got funding from, the answer was CDC. And I know that we are sitting here at a time today where people who are on the call have either just gotten notification that they will be continued funding or that they might not. And I want to just say to everyone, it's a hard time when we know that we're actually shrinking in number of programs, and it's really hard for those people who are facing uncertain job situation. I've actually added a question to the end of this webinar about that, just so we can get an idea of how certain you are about your job security. So I'd appreciate it if people would let us know. We're not going to associate that with your name or anything. But it is tough, and we're trying to build a nationwide physical activity program and network here. And I know that we've got folks who are still absorbing news that they've gotten recently. Now, physical activity skills that we asked about. Okay, so we asked about urgent and important training needs, and we gave a number of them. The top answer was answered by half the people, communicating the value of policy and environmental change activities. That was the same top answer as 2 years ago when 48% said that. So about half the people said communicating the value of policy and environmental change activities is the most important thing that they need help with. And second was rural, integrating PA interventions and policies within rural settings. That was also the second one 2 years ago at 47%. I mentioned that we did do a few webinars to try to address that one in particular. And we've done some that have tried to address the P&E as well, the policy and environmental change value as well. We can always do more, and I think that we can always use more input, I think, with our webinar committee on how we can help to address these issues. But it looks like there are a lot of things that at least 30% or a third of the people said that they have some interest in as far as urgent and important training needs go. Evaluation always comes up as a high one, and that's not surprising either, but it was a little bit lower this time around, but it's still above 40%. Okay, so we also asked folks if they would write in what they think are the most important skills for people to have to do physical activity and public health. And more than 100 people on the survey took the time to write in what they think the most important skills are. So I really appreciate that. This isn't terribly surprising, but communication came out so high that I actually had to adjust to make this all fit on one page. And that begs the question to me of what do you mean by communication skills? So I want to do a little poll here and see it just off the top of your head, what you would say that that meant. Launch. So some possibilities are that it means write succinctly, public speaking, advocating in meetings, developing appropriate messages for the audience, interpersonal communications. And just off the top of your head, what would you say this is? This is not scientific. This is just taking a straw poll of what we've got here as far as our audience goes. Give a few more seconds here. We've got about 40% of people have responded so far. And we did allow folks to check all that apply, but I'm just really curious what you think that communication skills means. If you're listening by phone, or if you are not otherwise able to put your vote in right now, you're welcome to email me at any time with your thoughts about what this means or how you would like to have it interpreted, and that's pam@physicalactivitysociety.org. Okay, so the poll's been open for a little bit here. Looks like the voting has died down, and did that come up when I closed it? No, okay. Looks like that your answers included the developing appropriate messages as by far the highest one. And advocating in meetings and interpersonal communications came in at 50 and 40%. And again, this is just a straw poll of what folks thought when you hear those terms. Now, public health skills. There are a number of public health skills that are common to lots of different projects. And so we asked about those just in a sense of what would you like more training on? Always would get evaluation. And I said earlier that that comes up a lot. So as far as public health skills go, leadership, helping to build partnerships and coalitions, working at the grassroots level showed up really well this time. And evaluation always comes up as one of the top ones. Don't ask me why surveillance didn't get a bar of its own. That's the vagaries of Google Slides. Now, the Physical Activity and Public Health Specialist certification, which is a certification that our organization, or its previous iteration of the organization, started in 2007 to develop. It was launched in 2010. It had subject matter experts that came from the National Physical Activity Society and worked with the American College of Sports Medicine, ACSM, to develop the certification. The PAPH competencies, I think there are over 50 of them. We used to, on the very first surveys, ask all of the competencies and ask people to self-rate themselves. It was not very useful. So the last 3 times we've been doing a subset of 10 competencies and asking about how much experience people have. And just to kind of give a visual overview here, this is going from things that people had the most experience in to the least, and just to get an idea of how people responded related to these competencies, which I'm going to show you the competencies momentarily. But they're really feeling more confident about recommending best practices and about the kinds of things that help to support behavior change than they are about, say, down at the bottom, social media or media advocacy. So you can just get a picture here of what people feel like they're doing the best. The numbers in parentheses there are the competency numbers, and so those correlate with the skills. So here we are, 10 competencies. We asked about social media, using public health data, best practices, about disparities and data illuminating disparities, interpreting non-public health data. That one that was near the top there, it's called behavioral supports on this list. It's a long one. It says address cultural, social, behavioral, and environmental factors contributing to both disease progression and health promoting behaviors. So that was a long one. Last time we summarized it as cultural competency. It's hard to summarize what all that means just into one concept. Analyzing and documenting physical activity programs was another one. That's an evaluation issue. And local PAPH, socio-ecological model, employing strategies that influence different levels of it, and using media advocacy. So that's the subset of 10. They were selected by a group a few years ago to talk about here in the survey because they were ones that we thought that we might be able to do some training about. And then we asked about formats for training. And I think people who work in physical activity and public health love webinars. So we got 85% who said yes to those. We put in short video modules from experts because that's something we'd like to get funding on to do. We don't actually have that funding right now, but it would be nice to be able to offer like a package thing on a website so that people could do it, to watch those and be able to get some education from their desks. Conferences rated at 56%. I have a feeling that that's more because people know that there's very little funding for conferences, and also even when there is funding, sometimes people can't get permission to go to it. So although conferences rate really highly among those who are asked, would you like to have a conference so that you can learn more from your colleagues? In this case, we said, what formats really appeal to you? And I think we actually said, would you be interested in? Twitter chats, not so much. I know that I've participated in several Twitter chats. They do feel like they kind of skim the surface of things. And we had one person who actually wrote, I really dislike Twitter chats. So, we're not going to rely on that for education. Now, connecting, we asked about organizations. This was distributed far and wide, so about 60% have said they were part of or familiar with the National Physical Activity Society. The first few are ones that we as an organization are strong partners with, and I think there's some others on there too. They're not necessarily in an order that would communicate that. APHA was about 2 out of 5 people, and American College of Sports Medicine was the same. I think the other PA organizations was really long, and so just to mention a few, people mentioned Shape America, that's SOFI, the Y. There's statewide public health associations, Change Lab, America Walks, which is part of the Everybody Walk Collaborative. They do the staffing. League of American Bicyclists, Heart Association, Safe States, Recreation and Park, many, many more. I would say that our members and the people who responded to this survey are really well connected with people who can provide information on a national level or strategies and best practices. And then finally, we asked, are you a member of NPAS? And 40% said yes, 44% said no. Just mentioned that membership is free. We have 500 members now, and we invite anyone to join who is not yet a member. So in summary, these are the conclusions that I'm drawing from what we said so far. So people who work in physical activity and public health work in lots of different settings, notably state and local public health agencies and universities. They tend to be highly educated, passionate, committed to the field. They want continuing education training in certain public health skills, particularly evaluation, but leadership, partnerships, and more. They often have other responsibilities besides physical activity. They work on a wide variety of everyday activities. They are connected and follow organizations statewide and nationally that can help them out. They access national resources occasionally. They tend to like webinars. They need help communicating the value of policy and environmental change. And as a whole, we could use an effort to recruit more diversity among our colleagues. So it's time for discussion, Suzanne, and I'll turn it back to you to lead that part.
Oh, hello. Thanks so much, Pam. That's great. So remember, if you have any questions, to please submit them through the chat box on your webinar screen. So Pam, one question is, can you, or maybe both of us, could talk a little bit about what the National Physical Activity Society offers to fulfill some of the needs that have been identified through the survey? I don't know if you want to give a little overview of some of the things we've done in the past to address the need for training around rural communities. Have we done anything for evaluation, any of that kind of thing?
Yes, and one project that we have that is, the entire thing is on our website, is around small towns. And, in this case, rural is towns that have populations between 1,500 and 25,000. We did 2 years in a row with 8 communities each time, where we did interviews and one-pagers on how they made changes within their small towns that help people to increase biking and walking. It's called Stories from Small Towns. It's on our website. The website, by the way, is going to be shifted over to something a bit more streamlined soon. So we understand that it's a little bit kind of needing of updates, but there's an entire section devoted to stories from small towns. We even have a webinar that had some of the speakers on it, including a mayor of a small town, and another one that's a city manager. And those, I think, are useful to people in showing that it's not just the big cities where you can do walking and biking.
Mm-hmm. Great, thank you. I thought that it was interesting that, our members are, looks like, as you noted, well-educated, mostly white women, I think was what we saw. yet many of us also are trying to reach more disparate populations. And so I'm wondering if you have any thoughts about how we can engage more minority, more high-need populations, either in our work or in our membership, or even into the profession.
Yeah, actually, there's been some good suggestions over time that there haven't been funding for yet, but one of them was to approach the nation's 37 HBCUs, and I think there's also that would be the historically Black colleges and universities. I used to work with a program that put out fellowships and internships for people from minority serving institutions. And we actually offered internships related to physical activity. It was amazing how infrequently people asked to do that. But so I think just building up more of a presence there within those universities and colleges could be a step toward it. That's a massive undertaking and something that I think was beyond the scope of what we've had funding to do. But so that's one of the a more overarching strategy. I think that there's probably lots of other ways, and there's probably interest groups that we haven't tapped into yet. I noticed that one of the questions that just came in was asking about tapping into a group that I'm not familiar with, and maybe our team can expand on this, called NSCA, and I'm not sure which group that is. So, yeah, I think there are several, though, that work specifically with minority populations that we could be doing more collaboration with.
Great, thanks, Pam. I'm not actually seeing comments or questions in the chat box. Maybe only you can see those. Are there some in there that you're seeing?
Just the one.
Okay.
Yeah.
All right, so
there we go. Okay. That means that probably I need to do the next question then. So here's someone who's National Strength and Conditioning Association. Thank you, Hartim. I appreciate that. And Anna also. Okay, so the next question, Suzanne, and I'll just play moderator for a moment here. Recently certified PAPHS wants to know if there's a directory of membership to connect with and learn from in local areas. What a great idea. This is someone who's connected to a large faith-based organization in the Metro DC area. And I think just to point out, I noticed that they said faith-based organization. That's one of the newer sections of the National Physical Activity Plan. It was added before the 2016 re-release. And so I'm sure you're familiar with that already, but just for other folks to know that there's now a faith-based section in there. There's not a directory of membership. In fact, we don't even have a list of the members. That all of that is managed by the American College of Sports Medicine, who's our partner in this. So they're the ones who maintain those records. But I think that would be a great idea if we did have more of a membership directory, even just for those who are members of NPAS. Mm-hmm. And, a way that could do it that could also respect privacy, et cetera.
Yeah, definitely.
Okay, so another person is asking about the PAPHS certification, about how important it is when looking for a job. I would say that I'm not actually familiar, and if folks have this in your state, please let me know. I'm not familiar with any states that require it, the PAPHS certification. We did have a question on our survey that I didn't present here about why people got certified, and one of them, the biggest issue was it's a tangible demonstration of their skills in physical activity. And so sometimes people said it was a personal goal. Those are reasons that folks have gotten certified. But no, I didn't show that slide actually. And how important is the plan to the organization and the members' success in their work? Suzanne, I would love to hear your perspective as someone who works at a state health department on the use of the National Physical Activity Plan. In my mind, it has captured fully the comprehensive list of needs for different sectors of society, and it's really kind of the basis around which we start thinking more about how we can improve what we're doing. In fact, I want to say that suggestion I made a little while ago about recruiting in minority institutions came from the plan. Do you have a response about that?
Yeah, I mean, I think I would agree that in one way it really helps in terms of my state, and creating a physical activity plan for our state, or even a chronic disease prevention or nutrition physical activity plan, it helps us to really think about and organize what our plan will look like so we can mirror some of the things in the National Physical Activity Plan. I think also, in terms of thinking about communication, a lot of times for us, it's really nice to have some national, well-researched, well-respected documents that we can point to when talking to partners and engaging partners, and to say, this is something that's being looked at on a national level. So we can use the plan to share with our partners and say we're using things, recommendations, strategies, focusing on sectors with some specific suggestions that are coming from our national experts. So it's really great to have those sorts of resources to rely on, to talk about, to feel really confident about our work, and to know that we're going in the right direction, or at least the direction that the nation is going in, as well as our little state.
Yeah, and I would encourage folks to just, if you haven't gotten familiar with the plan, don't think of it as needing to read the whole thing. I would say just go into the website and start clicking around and looking at what some of the suggestions are. To me, that's the easiest way to get familiar with it. You don't have to know the whole thing in order to find it useful. It's, again, physicalactivityplan.org. And just to explain the relationship again, I know our organizational names are similar. I am on the board for the National Physical Activity Plan Alliance. We didn't develop the plan. We do have similar names, but we are part of it. So I encourage playing around with it and taking a look at what you might be able to use. Oh, okay. So we have a suggestion here that from the nutrition world, the senior dietetic interns were required to rotate through state public health departments, and that was a valuable help in recruiting nutritionists into public health, and that could be a way to recruit a more diverse workforce. Thanks for the suggestion, Marianne. I appreciate that.
Mm-hmm.
Conveying the value of policy and environmental change because it's coming from a national level. So this is about the plan and talking about, meeting that need there where people said they needed help in communicating the value of policy and environmental change. Yes, I think using the plan in particular, it also helps to show that it's not all about just public health, and certainly not all about just fitness or fitness industry, that there are a lot of different ways to look at how we can increase physical activity, and the plan writes it all down so that we have it, we can pick up any section of it and try to use that as an example to explain with. Someone is asking, as a minority looking to get into public health, has a physical activity background, research in minority populations, how do you break into the industry with the lack of mentors and access? The mentoring program, I used to work at DHPE, and the internship and fellowship program that was run by Dr. Steve Owens for minority serving institutions was about how do you get mentors and preceptors to work with students from minority serving institutions to get them involved in public health and public health agencies nationwide. And so this is exactly what you're describing. And that program, I think it's like there's a skinny version of it that's still out there. Dr. Owens is now part of the Association of State Public Health Nutritionists. And so I should see him again soon. If I'm going to try and look into that and see what level that program is at right now. Okay, more questions? I don't see any more coming in right at the moment.
Pam, I wonder if you want to talk at all, if you have any thoughts. You did acknowledge the funding situation that many of us are struggling with or excited about today, or at least in the past few weeks, hearing about grant awards. And so if for folks who might be having a situation of reduced funding, are any thoughts about, how we can continue this work, or direction people could go in, partnerships, that people should be thinking about?
Yeah, I do have some thoughts about that, and just to acknowledge, we got this news ourselves last year. I've been on part-time status this year. I decided to continue doing this from a part-time point of view, and of course, that as a board member, but I don't know that it's necessarily been announced to the whole organization. That situation works for me, but it wouldn't work for most people. And so you have my empathy. Those of you who are looking at how do you transition to something soon. I would still like to see a nationwide program on physical activity. I worked in tobacco control when it went nationwide, and it was exciting, and people were passionate about it, and there was lots of momentum. And I really have expected that to happen in physical activity, and we just have had cut after cut after cut under every administration, it seems like. So I think that using our existing organizations, and people are looking at a lot of organizations for guidance, would be a way to help connect people to each other. And whether they're in states that are getting more funding from CDC or states that aren't, people still need to be able to connect with what's going on nationally so that they can keep up with what's happening, know who to ask for questions about what they're doing and how they're doing it and how well it worked and what didn't work. And that I think that there's a role there that we can help fulfill, whether it's for states that have a lot of funding or states that don't. In the early days, back in 1996, I remember when CDC was first gathering a list of who did physical activity. So we started with no national program and no organized program of funding for the states, and yet people were still gathering, okay, who's going to be our contact for each state? So, it's been done before on a shoestring, not the easiest way to do things, but I think it's still something that we could help to serve a role in. And I'd like to hear your perspective too, Suzanne.
Yeah, I think that those are some good thoughts. A couple of things that come to mind for me. I agree, wouldn't it be fabulous if we had a national physical activity funding for every state and, really strong, unified sort of initiative. I agree that there's lots of organizations out there. I think the Surgeon General's report that came out a few years ago is, another nice boost for our work. One of the things that I continue to look for are opportunities to work even in my state with the chronic disease programs like cancer and diabetes and cardiovascular disease. Many of those are more sort of funded in that health systems treatment realm, but if there are ways to partner and bring up the message of physical activity, I think that could be a useful way for us to be seen and heard. And then I was also going to mention, again, I think our organization, honestly, there are a couple of things. One is that we have several new board members who just came on this summer who are really enthusiastic, really passionate about the work. We are going to come up with a new work plan for this upcoming year. And so we'll think a little bit about some of these things around communications and maybe raising the awareness and the urgency and the messaging around the need for physical activity programming in every state. And I also encourage people to be joining our organization, and so we can show the power in numbers. Pam said we have 500 members, and I think that as that keeps growing, it's useful for us to be able to go back and say, look at all these people who are doing this kind of work, who are educated, who have so much experience and so much passion. There's such an opportunity to just really shift the conversation and the data of our country to look at how the efforts of our work and how things are being funded. So I encourage people to join our organization, contact us, talk to us, let us know what you want us to be working on, and find some unique partnerships and opportunities in your own states or communities to focus on.
Excellent. Okay, so I did get an answer to one of my questions from earlier, Suzanne, and
okay.
That's related to the minority internship program. It's called the Health Equity Internship Program. It is now run by the ASPHN, that's the Association of State Public Health Nutritionists. And thank you to the staff members for ASPHN who are on the call, one of whom I hired in 2000 to come and do a group of trainings on nutrition and physical activity throughout Georgia. So the Health Equity Internship Program does still exist, 30 interns per year. ASPHN is managing it, and I think that the website I can send out in the follow-up email that goes to people who attended this program today. It's on asphn.org.
Great. Thanks, Pam.
Yeah, and we had a question about finding resources in your local and state area. I'm not sure whether that means, funding resources. Yeah, that's going to be tough right now. I mean, there may be some that I'm not, if folks have ideas on how to answer that question, I would love to hear, go ahead and put them in the chat box. And then we also had a suggestion about the extension offices. And I know there was a program that funded some local extension or maybe statewide extension offices that funded extensions. And I found too, when I was with Georgia, that was a group that really was quite interested, I think because they had that nutrition focus already, that adding physical activity was something. But this person is also recommending that aligns well with lots of extensions programming to work on physical activity. So that's an interesting resource, I think.
Yeah, I would just comment in terms of some local funding. One of the things in Vermont that we're trying to do is really partner strongly with our hospital service areas. They do their community health needs assessments every year. And if anything related to physical activity comes up, they could make investments in communities to deal or address physical activity and nutrition. So we have health department staff that sit on all of those processes and those boards and those committees and advocate that locally some funds and some efforts are spent addressing physical activity because, of course, diabetes and heart disease and obesity and overweight are all things that come up as high needs in our communities.
I think there are actually two separate streams of funding that can come through those kinds of community needs assessments related to hospitals and also related to local health departments. It's not the local health department that has the stream of funding, but it is related to, they're bigger wellness areas. And I think I have just gotten out of beyond what it is that I know how to talk about that. Yes.
Yeah. It feels a little beyond me too, but I would start asking some questions of your hospital partners, community outreach folks, health department folks, if you're not with your health department, to see and start exploring that as an option.
Yeah. And we also had a notification or a reminder that the REACH program is going to announce its awardees soon. That's the Racial and Ethnic Approaches to Community Health, which was taken over into the section of CDC that also does physical activity a couple of years ago. And so that will be announced soon. Okay. And we've got a lot of folks who are trying to discuss, and it's making me wonder, how can we do more discussion calls? So if you have ideas on how, methods for getting more folks to be able to talk with each other, it is tough right now to build your group of colleagues across the country when we aren't having as many get-togethers nationwide. We don't have as many conferences to go to. We don't have as many opportunities to meet face-to-face. And so if you have found a way that works within that for talking with other people, I am really interested in hearing from you. And again, my email address is all over the website. It's pam@physicalactivitysociety.org. And Suzanne, I don't actually have the time up here in front of me. I can't see it while my computer is showing this.
It's 10 of. We still have about 10 minutes. 1:47.
Okay. Do we have any other questions?
And actually, let me just respond to that last situation that people are trying to have a conversation. One of the things that the board is working on, or that's come up before, are regional meetings, but not in person, maybe in person, but trying to get together people in different regions of the state through maybe a quarterly conference call or webinar to at least be able to talk with each other about this work. So more to come on that.
Yeah, and I think the Midwestern states have been particularly active in that, and maybe the Pacific Northwest as well. Yeah. So there have been some groups that have been really active in doing that. I want to see physical activity promotion spread throughout the whole country. I'd like to see it in more than just a fitness context because that appeals to a more narrow point of view. I'd like to see walking and biking become something that is expected in a city and streets be reclaimed by people to play in, whether it's kids or adults. Let's take back the streets. Around here where I live, right outside of Atlanta, I live in one of the more walkable communities, and on Halloween, you cannot get a car through here, which is really lucky, because it's just so crowded with people in the street playing and having fun. And it's the kind of street party that I wish we could see all the time. Mm. So I would love to see that idea of what they used to be like come back and spread across the country. Suzanne, I'm going to turn it to you for any last words, and we'll go ahead and wrap this up for today. There will be some follow-up material that'll come to you, including a link to the to the recording, and there will be a few things put up on the website later, and we will continue to use the information that we gleaned from our survey wherever we can to help promote physical activity and public health physical activity across the country.
Thanks, Pam. Yeah, no, I think that this was really great to see this information, and again, that we had so many respondents, and we have a good number of people on the call today. There's obviously a lot of interest in this. I just want to tell everybody to just keep up the good work and let us know, keep in touch with the society, email Pam, email me, just let us know what would be useful, or just pick up the phone and call. What do you need? How can we help? We are really, even though we have less funding, we're kind of flexible in some ways, so we might be able to take something on, especially if there's a big need or interest in it. But anyway, I think that is it. Again, just keep up all the great work, have a great week and fall, and you will be hearing from us in the future.
All right,
and I think that
Suzanne.
concludes our webinar for today.
All righty. Bye-bye.
Bye. Thanks, Pam.